Hi, I am Niharika Nanda, and you are listening to Express Podcasts. Mobile Creches has continued to be a catalyst in the space of childcare services for children of marginalized families since 1969. And through their efforts, they ensure family well-being, providing women with the choice to work and inclusive national growth. In the second part of our 5-part series, in association with Mobile Creches, we will talk about how some states in India are prioritizing a creche policy and the importance it holds, especially with regards to women's agency and reproductive rights. In this conversation, we are joined by IAS officer Dr. Rakesh Gupta, Additional Secretary to the President of India. He has served for 28 years across public health, gender and governance. As Joint Secretary in the Ministry of Women and Child Development, he had launched Mission Shakti to streamline maternity benefit schemes. As part of Mission Shakti's Palna scheme, there are over 1,700 Anganwadi cum creches and 1,200 plus standalone creches operational across India. In this conversation, Dr. Rakesh Gupta highlights Haryana's creche policy and the impact that it has had, especially on women's presence in the workforce. Dr. Rakesh, I welcome you to the show.
Thank you so much, Niharika, for having me here and speak about something which is very close to my heart.
Sir, can you begin by telling us about the creche policy in Haryana and what led to its creation?
So let me begin by giving you a brief context, the scenario in 2021 when we initiated our work on daycare centers or creches in Haryana state. So I was part of the conceptualization, the initial design, policy making, and only the initial implementation because I moved to Government of India in September 2021. So you have to understand the realities of Haryana in 2021. So we all know Honorable Prime Minister Mr. Modi, he launched his flagship Beti Bachao Beti Padhao program, that is Save the Girl Child program. And he chose Haryana, which was easily the worst state in the country or perhaps one of the worst demographics in the whole world where the girls were being killed in wombs. So son preference was there, It was like a mega issue for Haryana. So, but after his launch, due to concerted efforts by governments, doctors, civil society organizations, media, etc., the sex ratio at birth increased a lot from 871 to 920 in only 4-5 years. And we were able to save something like 35,000 girls in wombs. So this was very encouraging, but it was being observed that the women, they have started coming forward and they have started taking jobs in unconventional sectors like sports, armed forces, industry, etc. But still, the female work participation was not that good in 2021. And there were strong reasons for this. We understand that majority of Indian women, including Haryanvi women, they work in informal sector. So they don't have childcare and maternity support. So the existing systems like ICDS, Anganwadi, they are not actually designed for working mothers because of the issues of location, timings, and unavailability of age-appropriate care. We deeply understand that the lack of childcare facilities, they push women out of jobs post-childbirth. So, and they don't return back to the workplace. And of course, we see many women, they actually leave work within a year of childbirth because they are not able to cope up. And of course, this leads to the stress levels going up, all those issues going on. So recently, there was a report from the Status of World Population Report by a UN agency, UNFPA. So here also it was highlighted another aspect which has been highlighted very appropriately by this report. They said that there are couples who are actually not planning now for kids because of the financial issues or job insecurity. That is one aspect. And secondly, the couples, they are not actually going in for fertility because they see that there are not enough childcare facilities. So I think this is a very serious dimension. So without systemic support like childcare and maternity protection, so they have to choose between, women of course have to choose between, unfortunately, work and parenthood. So that is there, I think all this was weighing very heavily on us in our minds when we started this creche policy or the childcare facility in 2021.
So how did the government begin working on this issue? And in your view, what has been its impact?
So the government led by the then Chief Minister, Mr. Manohar Lal, so he wanted to start the daycare services in a big way. And he announced in his budget speech, he was holding the charge of finance minister also, that Haryana government would have 500 daycare centers throughout Haryana. So at that point of time, we were looking for partners because we didn't have in-house expertise to do this. So we invited Sumitra ji, who heads this Mobile Creches civil society organization. We invited them and we signed a MOU, memorandum of understanding with them, set up quality creches and to understand the issue and how exactly to solve it. So what we started with was to do a statewide assessment for having these daycare facilities in all 22 districts of Haryana. We spoke to them. We spoke to the different stakeholders, people on ground, the women. So, and then, of course, we started in a small way. We started having 30 daycare facilities. I'm not a part of the system in Haryana, but now I'm told there are 490 plus daycare centers working very successfully in Haryana. And I think the thing which really appeals to me and to many women on ground is that these have extended timings which are actually needed for the working woman. Then, of course, some capital costs, enhanced nutrition, uniform in honorariums, training, and public-private partnership. I think all these things make it very exciting. And these have been tailored to the needs of local women. And these facilities are near their workplaces. And of course, there is trained staff, nutritious meals. And of course, the way it has been designed is it is low cost effective. And about its impact, some initial surveys have been done, which are reporting that there is an increase in family income because of these daycare facilities, because women are able to work. And the women either are continuing or they are joining the workforce because of the presence of these daycare facilities. And of course, because supplementary nutrition is there, we are talking about early childhood development. So there is an improved in early childhood nutrition and health as well. So currently, I'm told there are almost 9,000 beneficiaries, the women who are actually sending their children to these daycare facilities. So this overall approach is very comprehensive, data driven, and I think it has become a national success story. So of course, because it talks about quality, inclusive childcare in India. So I think Government of India is taking keen interest in understanding the various facets of this particular scheme, and various state governments like Telangana, Assam, Bihar, they have visited the state. I think the state leadership, led by Mr. Naib Singh Saini, the Honorable Chief Minister of Haryana, they are actually willing to support it further.
Right. And Dr. Rakesh, all this tells us how Haryana has seen real systemic change. What government approaches made that possible?
So I spoke about the daycare facilities in Haryana. So I've had experience of working on highly impactful, I would say, maternal and reproductive health and women empowerment and safety, big projects, both at the state level and the national levels. And I think there are some key levers which we used in all these different programs at state and national level. And now, of course, some of those things are reflected in the way the Haryana state is running their daycare centers. So I would like to highlight 5, 6 points. One is that multiple partners, like for example, when I used to work in maternal and child health in the state of Haryana. So we had engaged the academia, UN agencies, the WHO, USAID, civil society organizations like INCLIN, Society for Applied SAS, it is called. And then, of course, community, local bodies. With this, we were able to ensure that the maternal mortality, it is reduced by one third and infant mortality reduced by one fourth during a period of only 3 years. Second, I would highlight is that we have relied in the past and now in this daycare facility is on intersectoral and interdepartmental coordination. So if we talk about health sector, so the Women and Child Development Department is there, health is there, local bodies, police, law. So all these departments, they actually work together to bring about change in the scenario, in the households, in the lives of women. Then another very critical aspect, which I think we have borrowed from the other programs, is employing data and digital means. For example, I would like to highlight the Mission Shakti of Government of India, which is a program for women empowerment, safety, security, financial inclusion. So here we have been able to create databases, web portals, which give us, information, data, which helps in making evidence-informed or data-informed policies or programs. And then I think one more very important aspect is about, we have to think of bringing about transformative results using social and behavioral change. This is something which is very, very important. I would like to highlight a personal favorite. So when we were working on reducing the unmet need in the state of Haryana, so we had to really understand what is going wrong and what kind of messages have to be sent to women or their families, their husbands, community. So we did a formatic research kind of thing with the expert people coming from outside. What kind of messages have to send? What kind of media mix had to be used? And of course, we were able to make a huge difference. We were able to make a dent on the unmet need for contraceptives. And of course, the Haryana, we actually reached the replacement level of fertility. Of course, much more needs to be done. So we were actually using the spacing methods as a mean to actually delay pregnancy, and which of course improves the reproductive health of women, and that takes care of the child as well. Another thing I would like to highlight is the shared vision. So when we did our work on Beti Bachao, Beti Padhao, so save the girl child. So there also we work with community, knowledge partners, the government, different stakeholders, departments, academia, and we were really interested in bringing everyone together towards a shared vision. So unless we have that kind of shared vision, we actually cannot really bring about results. And finally, I would like to say that the rights-based approach, this is something which has really helped us in shaping up policies, programs for the women until their concept, all know. So the women who are standing last in the row, reaching the unreached, I think that is something which has really helped us. And because of all these basic concepts, so what we observe is real systemic change through all these interventions.
Absolutely, sir. And you've throughout your career championed reforms around women's rights and equity. Did that shape your focus on creches as a way to support women's agency and reproductive choice?
So, Niharika, I would say that my life is committed for women and children, and it's a career-long commitment, lifelong commitment to promote women's rights and agency, especially during pregnancy, postpartum, when they're most vulnerable to systemic gaps which are there in our systems, families, community. So, what I have been doing is to build integrated systems that support women beyond delivery, recognizing that fragmented service we provide, these undermine both dignity and choice of women. So some examples, I worked on Pradhan Mantri Matritva Vandana Yojana, which is a maternity benefit scheme. So here we sort of introduced it for informal workers by adding real-time tracking and grievances redressal. So this way we ensured that the entitlements, they reach women in time. Another example, we built dashboards for when we were working in maternal health, family planning. So which really helped us in linking maternal death, service coverage, equity. So all these things are very, very important. And under Mission Shakti, we had these expanded one-stop centers, which are actually there to address the legal, emotional, and safety needs of women during and after pregnancy as well. And of course, for that, we work with Gates Foundation, NIMHANS, and other stakeholders. So overall, I see childcare as part of a larger agenda, enabling women to participate fully in economic, public, and family life, not as secondary earners or caregivers, but as equal, empowered citizens. That is my philosophy so far.
And so that truly shows in the efforts that you've made over the years, for which I, as a woman, am really grateful to you. And Dr. Rakesh, what parts of Haryana's creche model and support for new mothers are replicable in other Indian states or even globally, especially in similar gender and care economy contexts?
If we understand how this childcare model, Haryana's model has come up. So here we work with the communities, the local bodies in village and, for example, the panchayats, municipalities. So it aligns very well with the decentralized governance structures as promoted by the Indian Constitution. So it is very easy to replicate across different states, or I would say even globally also in similar kind of situations, low middle income settings. So it can be expanded, taken to other places. So the another thing which is important is I said earlier also that these creches are near the markets, farms, and construction sites. So these are the places where women actually work, not like Anganwadi system, which are close to the place where the women actually reside. So this design can be very helpful when we think of adapting it in other states or other low middle income countries where we have large informal and non-office female workforces. So that is the second thing which I wanted to highlight. And then the interesting part here in this scheme is I spoke about the intersectoral coordination and convergence. So here the different departments, different schemes are converging. So it is integrated with existing maternal health, postnatal, and social protection schemes. So this allows smoother uptake. So other states and countries can actually build on existing program architecture. So reducing need for new infrastructure. So it's very cost effective. And I think the behavioral change efforts, which are there as part of this policy, so these efforts, they are basically trying to shift perceptions of childcare from a private duty to a public good. So I spoke about the infrastructure, public infrastructure, which is required. So this all lays the groundwork for replication, especially in patriarchal societies where unpaid care work is undervalued. So overall, I would say that this childcare initiative of Haryana is promoting reproductive agency. So it is actually empowering women, of course, with their spouses to take decisions about their own fertility choices, which is so very important. And of course, it really empowers the women economically. So women as part of the family, they can actually do good for them, for the children.
Right. And Dr. Rakesh, now that the Indian government is working on the Viksit Bharat 2047 project, what role can early childhood care and the concept of creches and daycare systems play in achieving that goal?
So internationally, Niharika, we talk about the life cycle approach, starting from adolescence, pregnancy, childbirth, and then the early childcare development. So all these things are related. So we have to really invest in all these stages. So this particular mobile creches is addressing many of these issues, which will really help us make our country Viksit Bharat. It's all about human resource development. If we are really able to invest ourselves in the health of reproductive health of women, early childhood development, nothing like it.
You were listening to Dr. Rakesh Gupta in the second part of our 5-part series in association with Mobile Creches. If you want to listen to the first episode, the link for the same is provided in the description. Today's show was edited and mixed by Suresh Pawar and produced by me, Niharika Nanda. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Podcasts or write to us at podcasts@indianexpress.com.